So we're going to start with the most common type of conjunctivitis, but there's a few other types I'm sure you probably haven't heard. We're going to start by talking about bacterial conjunctivitis, caused typically by a bacteria. It can be from a wide variety of types of gram-positive and gram-negative bacteria. This can range from Staphylococcus to Streptococcus to Pseudomonas to all different types of bacteria that can make a nasty mess on the cornea. So what do I mean by nasty mess? So what I mean by that is, let's say a bacteria gets on your cornea, decides it becomes opportunistic or wanting to invade the eyeball and multiply and reproduce, because that's what bacteria do. And it goes through several corneal layers, which can erode the epithelium, leaving what's called a corneal ulcer, because a corneal ulcer is what happens whenever you have a missing section of epithelium in the cornea, plus subepithelial infiltrates, also known as white blood cells, that are put there by your body and directed there to clear up an infection. Bacterial conjunctivitis happens pretty rapidly, usually within a couple of days onset, and can be noted by a red eye, pain, blurry vision, light sensitivity, all different types of symptoms that happen pretty quickly. And it usually sticks to one eye unless you literally touch the eye or anywhere around the infected eye and share the love with the other eye, which you can have it in both eyes at that rate. But usually what happens is when the bacteria latches on, it typically starts in just one eyeball. Normal course of treatment for bacterial conjunctivitis is typically some topical antibiotics. By that, we usually mean eye drops, antibiotic eye drops, or it could be that you might need oral antibiotics if it goes into other areas like the eyelid, the skin, or if it decides to invade deeper into your eye, you might need oral antibiotics plus eye drop antibiotics. And in very, very rare cases, it can lead to pretty severe infections that might require IV antibiotics, honestly, which by that point you would be admitted into the hospital and different things like that. But usually they're caught early enough and people pick up on symptoms early enough. This is why it's a good idea, if you wear contact lenses and you happen to get bacterial conjunctivitis or pink eye or anything like that, that you don't typically wear your contact lenses while you're being treated for this, that you actually wear your glasses to give your eyes a chance to heal, regenerate, restore, and clear out the infection while using the antibiotics. What about viral conjunctivitis or viral pink eye caused by a virus?